For the past decade, Ontario has been experiencing a major opioid crisis. The number of overdosing cases has been increasing rapidly in Ontario since 2013. The prevalence of the opioid crisis is apparent in Hamilton. What's missing is the lived experiences to provide motivation for creating policy. In association with CityLab, our group of students from Bezemer University is creating a project proposal to lay out a plan of how to collect these lived experiences. Once our project proposal is complete, the City of Hamilton can choose whether to use our plan to move forward with interviewing those struggling with addiction to opioids. Although we have access to a lot of data regarding the opioid crisis, the human element to our numbers is missing. The goal of our proposal is to make sure the people experiencing addiction to opioids in Hamilton do not get lost to the numbers and statistics. We're hoping that hearing the testimonies of these persons will help policymakers to gain a deeper understanding of how opioid addictions occur, how it affects the victims, and what changes need to be made. The issue of the opioid crisis is very complex, with no simple solution. Overdosing rates continue to increase, not due to a lack of services, but to a complex intertwining of many factors. These factors include social, structural, and economic forces. One study found that cheaper supplies of drugs like heroin have accounted for almost 80% of deaths due to opioid overdose in 2019. Despite copious research and theoretical knowledge of the drivers of the crisis, the stories of real people battling this crisis continue to teach us that it's engagement with and listening to individuals which will most effectively assist the victims of this crisis. The population that we have chosen to focus on for our project proposal is homeless women, as they face an increased number of obstacles in receiving the help and resources that they need. The municipal and provincial government has compiled information concerning this population group and found that during the pandemic, there have been an increase of 43% in the number of opioid-related deaths among women. It was also found that 1 out of 6 opioid-related deaths are individuals within the homeless community. In order to gather these lived stories, our research proposal will suggest the use of semi-structured interviews. Our proposal will be to recruit participants in our target demographic through flyers, posters, and information sheets at community centers and first responder locations. Interviews can take place at safe consumption sites, homeless shelters, and rehab centers. The interviewer would desirably be a certified social worker or psychiatrist. Data will be gathered through anonymous audio recordings of the interview. The stories will then be compiled into a report by a statistician. We hope that our research proposal will affect change in Hamilton, allowing for better care of our population experiencing opioid addiction and creating spaces where everyone can feel safe receiving care.